So NBS released a story recently about a fake doctor who was impersonating someone for close to 10 years now. There was that story that trended on NBS Investigates. Mr. Semanda. Semanda has been practicing for 10 years with a license as a doctor, but he had never studied medicine. And for me, that is interesting. Okay, not so interesting, because a guy was bold enough to actually do surgeries, work on patients, and when you watch the documentary, they actually tell you he was the consultant, he was the pediatrician, he was the obstetrician, he was the surgeon, he was the gynecologist, everything was around him. The composure you need to reach such a level, the confidence you need to pull off such a haste is, I've not yet achieved such levels. I hope one day I can be this bold. I think that is what is hindering me from going to the next level. Because even when they came to arrest this man, you could not actually, if they positioned both doctors there, you could not tell who was the fake and who was the real one. It takes a lot of confidence and practice to be in such a, and it took the guy to police, of course, and then I don't know what happens, but police found him not guilty. We don't know what went on, and then they released him. See, now my worry, two things. I worry about two things. The first thing is that does he go back to practice in the clinic, or do they close it? We might never know, because Ugandans move on very quickly. This story has come and it's going to pass very quickly. Then the second worry is, what about the rest? Because I know this is the only one they have managed to catch. Because it cannot only be one person doing this. And okay, maybe a third worry is, the main takeaway is you just have to be brave to pursue your dreams, no matter what. And I'm not encouraging you to be fraudsters, because we shall fall in you, to jabagwam. But why would someone who has never done anatomy do a surgery? Like you open someone's body up and you start performing surgeries? Like, these are not things you can learn on the job. Like, let me first do one patient and I see how it goes. Like, guys, and I think this is where most of the traditional healers actually beat the medical doctors. It's composure, that boldness to look into someone's eye and lie to them and just convince them that, yes, I want to give you this drug. It can cure cancer, it can cure ulcers, it can also help you with appetite. It can, if you have lost lovers, it can bring it back. Like, that boldness, we don't have it, because for us, we are guided by books, and we follow a certain pathway. If it doesn't do this, stop. But the other guys out there, Semanda, 10 years, Semanda. The story is similar to that Kenyan lawyer who was winning very many cases in Kenya, but he had never gone to law school. Only difference here is that the other guy was winning and he doesn't deal with people's lives. Now that this guy was doing surgeries on people. And people are asking, where is the Ministry of Health? Where is the Uganda Medical Dental Council? What have they done? How can they let this go on? Like, the guy renewed his licenses for more than 10 years, I think, and no one noticed. But you guys forget your leaders. Now this makes it a little bit difficult for us, because now I think patients are going to just start asking for our licenses before you can actually watch them. Like, which medical school did you go to? Let me see your license. Who are your OBs? Name 5.